Everyone. Welcome back to the stage, Mother Lab. Our panelists today will talk to you about our toolkit. We have Amaya Menta, Lauren Cohen, Iman Anwar, and I'm looking for Gabby Ruiz. Thank you all so much for being here. And we're going to have a conversation about the Maternal Health Policy Toolkit that Mother Lab has developed, which is an amazing resource to help you, our audience, learn how to get involved from everything you've heard today and moving on with next steps and improving systems for Black mothers. So without further ado, I'm going to turn it over to Lab, the Mother Lab. Thank you all so much, and we look forward to an engaging conversation.
Hi, everyone. My name is Lauren Cohen, and I am one of the co-chairs of the Community Engagement, Advocacy, and Policy Committee at Mother Lab. I'm a senior at Tufts University, and I'm double majoring in biology and child study and human development.
Hi everyone, my name is Iman. I'm also a senior at Tufts University, majoring in biology and community health. I'm also a co-chair like Lauren for the Community Engagement, Advocacy, and Policy Committee. And I'll hand it over to Amaya now.
Hi everyone, I'm Amaya. I'm a sophomore at Tufts University studying community health, and I'm the advocacy liaison of the Community Engagement, Advocacy, and Policy Committee. And I'll turn it over to Gabby.
Hi everyone, I'm Gabby. I'm a second year MPH student at the George Washington University, and I'm studying maternal and child health, and I'm a member of the Research and Grants Committee.
If you could project the toolkit PowerPoint. Great, thank you. So one of the major responsibilities of the Community Engagement, Advocacy, and Policy Committee at Mother Lab is to stay abreast of relevant national and statewide legislation that is related to maternal health. And since our inception in July 2020, we have been working to educate ourselves and others on such policies, as well as advocate for the passage of legislation that will amplify the voices of Black women and eradicate maternal health disparities. We are proud to have created and to be presenting this toolkit to all the attendees of the Black Maternal Health Conference today, and the toolkit will be sent out to all the attendees following today's events. Next slide. So this is just a table of contents going through the toolkit, but we'll move right past this and get started with the first bit of content.
So as Lauren mentioned, we are the Mother Lab. Mother Lab stands for Maternal Outcomes for Translational Health Equity Research. And our mission is to address and eradicate inequities Black women face through research, advocacy, and mentorship by confronting and dismantling the system that perpetuates racism. So a little bit about this toolkit, we find that it is extremely important to get involved in the legislative process through advocacy and education. And it is one of the best ways to push for bills that you care about, that we all care about. And it is the best way to amplify the voices of Black women. So this toolkit was created by the Community Engagement, Advocacy, and Policy Committee, myself, Lauren Cohen, Amaya Menta, and Heather Olden at the Mother Lab. We believe that advocacy is vital for translating research into policy. As students, we are the future of the intersection of policy and healthcare. And advocacy is a very underutilized tool that can break barriers to access to care and increase the quality of maternal healthcare services. Next slide, please.
We just wanted to take a moment during our presentation to shout out our wonderful director, Dr. Ayo, who has been an inspiration to every single member of the lab. I'm not sure where we'd be without her constant support and love, and Dr. Ayo shows us daily what it means to be a leader who holds herself with grace and demands respect from every space that she's in. She's taken the time to individually mentor each and every single one of us, and this has only furthered the tight-knit group of the Mother Lab. And we just wanted to highlight some of her amazing accomplishments. While you can read about this more on themotherlab.org, here's just a few that we are super, super proud of. Dr. Ayo was the only Black woman to receive a named professorship from the Tufts University School of Medicine. She was also given the distinction of the top 40 under 40 minority leaders in healthcare from the National Minority Quality Forum, and has been the principal investigator on a multitude of different studies on maternal mortality. We are so grateful to have such a powerful and inspiring lab director. Next slide, please.
In our experience as students, we have found that understanding the legislative process has made it easier to understand how to get involved in advocacy and at the policy level. Like us, many people who don't know how a bill becomes a law, and we hope that this slide will provide a brief explanation for those of you who might be new to the world of policy, like I was not that long ago. So bills can be introduced either in the House of Representatives or the Senate at the national level. And on this slide, we only listed the steps that a bill goes through when it's introduced in the House, although processes are relatively similar when it's introduced in the Senate as well. We have also linked the webpage explaining how a bill becomes a law more in depth on the bottom of this page in the toolkit, which can be found on the United States House of Representatives website. So after a representative sponsors a bill, it is sent to a relevant committee to be studied. And most of the bills that we have looked at through Mother Lab have been sent to committees ranging to or relating to finance or health, because those are kind of the bills that we're most focused on. But there are committees in the House of Representatives that deal with topics ranging from agriculture to the military to education, and even a ton of more topics as well. So the committee may choose to vote on the bill, and if it passes the House with a simple majority, it will be sent to the Senate, where it's assigned to another committee. The Senate can then discuss, debate, and vote on the bill, and if passed by a simple majority in the Senate, the bill goes to a third committee, which is comprised of members of both the House of Representatives and the Senate. And in this committee, they reach a compromise and work out any differences in the bill. After final approval from the House and the Senate, the president has 10 days in which to sign the bill into law or to veto the bill. So on the bottom half of the slide, we see about information about what it means to co-sponsor a bill. So a bill is sponsored by a senator or representative, and when legislators co-sponsor, they're showing their support for that bill. And co-sponsoring often leads to the bill gaining more attention because more legislators have signed on to and support the bill and are able to talk about it among their constituents as well. Next slide, please.
So I'm just going to talk a little bit about how the U.S. Congress is structured and then more details into the Massachusetts legislature. In terms of Congress, we have the Senate and the House of Representatives, and the Senate has 100 U.S. senators with 2 from each state, and they represent their entire state as well as serving a 6-year term. In comparison, the House of Representatives has 435 voting members with at least 1 from each state, and they in fact represent their districts, which are regions within their own districts. As we know, we have Rep. Liz Miranda here, so Rep. Liz Miranda is obviously part of the House of Representatives, and each representative serves a 2-year term. This can be contrasted to the senators that serve a 6-year term. Now, more specifically into the Massachusetts legislature, we have our senates that represent their entire state, and we have 40 members, with the president of the Massachusetts Senate being Senator Karen Spika. And the House of Representatives, we have 160 members, and the Speaker of the House is Representative Robert DeLeo. Next slide, please.
After talking about a little bit about the structure of the House of Representatives and Senate, we just wanted to highlight the accessibility of how to find and contact your representatives. Policy work definitely seems not accessible at all ages, but we just wanted to show how even at an undergrad level, you can find and contact your representatives and lobby for things that you're passionate about. So one of the things that makes a huge difference is going to the malegislator.org, and you can find your House of Representatives and state senator very easily by using that website. All you need is to put in a little bit of personal information, and you can come on your way to making a difference in the policy world. Next slide, please.
Calling and emailing your legislator are both great ways to show your dedication to specific bills and to speak to someone from your legislator's office. You might not speak with your representative directly, but you'll speak with someone on their staff who can then relay your message to your representative and show your support for the bill. And as their constituent, your representative and senators want to hear from you as they represent your interest in Congress. When engaging your legislator, it is important to discuss what the problem is, why the bill is important to you, why your legislator should care, and what you're asking them to do, as it will make your argument more compelling and give them an action item. Mother Lab has engaged in both phone calls and emails to our legislators. We're a lab made up of women from all across the country, and we built support for bills both in Massachusetts and at the national level. In 2020, we successfully advocated for the passage of Massachusetts Bill H4818, an act to reduce racial disparities in maternal health, which Governor Baker signed into law, thanks to our calling and emailing. This year, we're reaching out to our representatives in the United States Congress to co-sponsor or support Bill S-1765, which is the Maternal Health Quality Improvement Act. And by working together to advocate for bills that are important to us, we have found that we can create change. And on the next slide, Iman will be discussing some ways to engage our legislature that are a little bit more public and could be less direct, but could have a huge impact as well. Next slide, please.
So some public methods of engagement are social media. We are now, especially since the COVID-19 pandemic, a virtual community, and we at the Mother Lab have found that social media has helped us build momentum and increase traction for different bills. So whether this is retweeting on Twitter, sharing an Instagram post, or posting on your story, Facebook, LinkedIn, it's all there and it's all out there. And the more you post, the more other people have also the opportunity to see what you're talking about. And it's possible that they probably care about what you care about too. So just getting it out there and spreading the word is the best way for the bill to gain traction and for the governors to sign the bill. Now, another method is also virtual hearings, and attending virtual hearings and special events will not only help you become more familiar with the process, but is also the best form of showing support. If you went to a concert to support your friend, you're sitting in the audience. Now, going to a virtual hearing, not only do you learn more about what's actually happening, but like others, you're supporting the bill. And you also have the opportunity to publicly testify at a virtual hearing. Now, this can be anybody, and you're advocating and amplifying the voices of Black women. So if you are interested in attending a virtual hearing, you can find on our toolkit a link that will send you to the Massachusetts website where a list of virtual hearings are shown. And if you would also like to get more involved but aren't fully sure as to how to approach it, feel free to contact us. Next slide, please.
Hi, everyone. I'm so sorry. I think I'm having technical difficulties. So I'm going to talk about some policies introduced at the national level, such as the Black Maternal Health Omnibus Act. So there's 12 individual bills that seek to end preventable maternal mortality and severe maternal morbidity in the U.S. and reduce disparities in maternal health outcomes. We're doing this by making critical investments in social determinants of health that influence maternal health outcomes, providing funding to community-based organizations that are working to improve maternal health outcomes and promote equity, comprehensively studying the unique risks facing pregnant women and postpartum veterans, supporting veteran maternity leave, growing and diversifying the prenatal workforce, improving data collection quality measures, supporting moms with maternal mental health conditions and substance use disorders, improving maternal health care and support for incarcerated moms, investing in digital tools like telehealth to improve maternal health outcomes in underserved areas, promoting payment models to incentivize high-quality maternity care and continuity of insurance coverage, investing in federal programs to address the unique risks for and effects of COVID-19 during and after pregnancy, investing in community-based initiatives to reduce levels of and exposure to climate change, and promoting maternal vaccinations to protect the health and safety of moms and babies. Next slide, please. So the Social Determinants Accelerator Act is aimed at providing planning grants and technical assistance to help states and communities address the social determinants of health for high-need Medicaid beneficiaries. And in the state of Mississippi, where abortions are currently banned after 15 weeks, Jackson Women's Health Organization is one of the last remaining clinics that provides abortions in Mississippi. So this bill will be the first ruling on the constitutionality of pre-viability abortion bans before Roe v. Wade. So this is a very important ruling in the criminalization of abortion in the U.S. Supreme Court decisions, and it's pending. The Maternal Care Act aims at eliminating racial disparities in maternal health outcomes by supporting states in their work to end preventable morbidity and mortality in maternity care through the usage of evidence-based quality improvement to protect the health of mothers during pregnancy, childbirth, and the postpartum period. And the Triumph for New Moms Act of 2021 works to develop a national strategy for maternal mental health by engaging in state and local partnerships and dispersing reports on the best practices, policies, and programs to reduce disparities in maternal mental health conditions. Next slide, please. Next, I'm going to speak on some policies introduced in the state of Massachusetts. So an act advancing the health of pregnant persons will guarantee that the coverage provided for pregnant persons is not subject to any deductible, coinsurance, copayment, or cost-sharing requirements. And an act relative to postpartum depression screening will provide coverage for screenings for postpartum depression conducted during any visit within 1 year of the child's birth. And an act relative to expanding equitable access to maternal postpartum care extends Mass Health coverage to pregnant and postpartum residents of Massachusetts for up to 12 months following the pregnancy, regardless of any change in the family's income. And I'll pass it on to Iman to speak about the last policy.
So the Fetal Infant Mortality Review is a bill that we have been working closely with the Community Action Network at Boston Public Health Commission. The FEMR, as it is known as, is a public health process that allows local communities to identify the causes behind the unequal rates of fetal and infant death. It is not to assign blame, but understand the causes that resulted in the death, from the social and structural to societal factors. And most recently in Massachusetts, it has passed the Public Health Committee. Next slide, please.
We hope that everyone enjoyed our presentation today, and make sure to follow and stay connected with the Mother Lab at all of our socials on Instagram, Facebook, Twitter, LinkedIn, and others. And if you would like to see and view this policy toolkit again, you can find it at themotherlab.org.
Excellent, everyone. So I am just going to see someone throw me a message backstage at exactly how much time we have left. Looks like we have about 10 minutes. So I'm going to any questions from our audience here. Thank you again to my amazing Mother Lab team. And thank you for that beautiful, beautiful slide in the beginning. I was like, oh, so beautiful. Thank you guys. That was really sweet. So does anybody have any questions for us? I think, the work that we're doing here around policy, and at the time, when I started Mother Lab almost 2 years ago, I didn't even realize how much legislation and so many opportunities that there were. I just knew that policy had to be a part of the conversation. And, as we've heard from some of our speakers today, both at the local, state, and federal level, this is such a movement and this is such a time now for policy. So for Mother Lab to be really able to enter into that space and provide expertise and leadership around policy has been really nice to see. So I'm looking for questions here in the chat to see. Okay. Yeah, I'm not seeing any questions so far. Anything else from the panel? Anything else you guys would like to talk about? Maybe, since we have the floor, talk about, some of the things, like where do you guys see as the most systematic opportunity for pushing policy? So you guys talked about some of the things that we've done. Lauren, you talked about the maternal health quality letter that's going to be going out, some of the things that we've successfully advocated for, but where do you guys see the opportunity for today? So I'll start off with an example. As I was thinking about preparing my remarks here today, thank you for the question, Tina. As I was thinking about preparing my remarks here today, I was chatting backstage with the CMS administrator this morning, who's lovely, the first Black woman in that position, Chiquita Brooks Ashore, and we were talking about policy. We know that 60% of births in this country are to a Medicaid population, which is obviously under her purview as the administrator. And I think, it just provides such an opportunity to think about the overlap between community engagement, research, social justice, reproductive justice, and then moving that work forward. And one thing I always hear from when I give talks and people are like, how do we, get into these spaces? I just want to remind our audience, one, that these elected officials, local, state, and national, they're in positions that we put them in. We have to vote them in, we have to support their work, and we have to really hold them accountable. So I think that's one thing that people who are not maybe connected to a research institution or a Mother Lab, or maybe not, have this background. We didn't have the background when we started the Community Engagement Committee, and here we are doing this amazing federal and state level policy work. So I think it's just a matter of one, finding out who are your local people, who are the people that are in office to support you, how can you get connected to them? You will always be able to do, legislative work both in your local area and in DC. All these elected officials have health policy staffers that love to hear from constituents. That's why if you ever call a senator or congressperson in DC, they always say, what's your zip code? What's your area? Because they want to make sure you're in their district. And so that they can respond to your questions in that way. So we all have the power and the advocacy to do the work. And you don't need any degrees. You don't need anything fancy to do it. Just get in there and do it from your heart. Advocate for the work that needs to be done. Hold people accountable publicly. Back it with science, back it with lived experience, and the work will move. So I just wanted to say that. I do see a question here in the chat from Tina saying that says, how do you stay up to date on policies that are in the pipeline? That's a great question, Tina. I think you have to be at the table, and I'm smiling because I literally just reviewed. So my home state is New Jersey, but I live here in Massachusetts. I've been here for 5 years, and I remember when the legislation for the background to start the Racial Inequities and Maternal Health Commission, that legislation was going through the House and moving through the Senate. I had the chance to review it because I had been doing the work, and I was just one of the people that was on short list. Hey, Dr. Mutap, would you mind looking at this legislation? And I was like, absolutely. I've looked at stuff for Senator Warren's office. I've looked at stuff for, it's going through the state here. I just got an email yesterday. Something is about to be passed in New Jersey around maternal health and oral health. Somebody found me and sent it to me and I edited it. Like, it's just a matter of doing the work, and people will find you. I mean, I'm always so surprised and a little like, how did you find me? They're like, Dr. Muthi, your name is everywhere. Because I just do the work. I'm not like in it for the politics and the political things that can come with that. But when you're doing the work from your heart genuinely and you do it with passion, I think people will find you. And that's the work that we've seen here in Mother Lab, right? Mother Lab started off, I was looking at some of our earlier agendas and I'm like, wow, we've really grown from where we started in 2020. Just our impact, our premise, our structure is just so much, clearer and tighter. And so I'll just say that, to how do you stay abreast of what's happening is just to be doing the work and to stay connected to your local and state officials. I see another question here. How can our local mayors help advocate for the needs of mothers in their city? I think that's a great opportunity. If anybody here can get me close to Michelle Wu, I'd love that. Because I think there's a lot of work that can be done here in the greater Boston and Massachusetts area as well. I mean, we are leading the work, right? I would definitely say Massachusetts is a place that there's tremendous opportunity, tremendous things that are already happening, but you can always do more, right? And I think that's one of the things, getting close to local mayors and working on the ground and a grassroots level. You can run for city council, right? You can do that type of work at your local level. My best friend in my hometown of Trenton, New Jersey, she's running for city council right now. That's how you do the work. You don't have to be a lifelong politician. She's just a lifelong Trentonian who's ready to make a difference, and she's running for city council. Her name is Jenna Kettenberg, if anybody here's from South Trenton, New Jersey. So, it's one of those things where the work will find you, but when it comes to getting at the local mayoral level, I think being on city council, doing community-based events, being an advocate at the community level, people will notice that and you'll get the traction. So I guess both of the questions I'm asking are kind of in the same vein. Do the work and the people will come. It sounds a little cliche, but it's really not, because it's a system that we've done here at Mother Lab. And as everyone here can attest to, people are finding us every kind of way through social media, our podcast, website, YouTube, LinkedIn. I mean, we're just doing the work. And so people are finding us. Which policy seems to be the most important at this moment? I mean, there's so many. I'll let you guys answer that. But for me, there's so many things that are incredibly important. Like the work that's happening around abortion disparities, the work that's happening now. Liz Miranda was talking about birth justice here in Massachusetts. So many opportunities that are very, very critically important. But I love to hear from the experts in the room, which is my Mother Lab team. So what do you guys think about some of the most important policies that you guys have researched, or things that have really struck you like, oh, we should be supporting this now? And then I see two more questions, and I think that'll get us out of here. Thanks.
I can take this one. So as you said, there's obviously a lot of policies that are coming out every day. And so I think it's part of our job is to kind of look through these policies, and we might not all have the exact same qualifications of what is the most important to us personally, but really just looking out for kind of maternal health policies in general. One of the ones that we're focusing on is the Maternal Health Quality Improvement Act, which I spoke about a little bit earlier in the presentation. It's one that is accessible to Mother Lab members. It's been introduced in the House of Representatives, so all of us can kind of have a say and can, lobby our individual representatives on that front. Some other policies are like the Momnibus Act and FEMA bills in different states. I think what's important is to figure out like what in maternal health is the most important to you, and kind of, going about it that way. As Mother Lab, we're trying to present kind of all of the policies that we can find, and we are all individually working on our own to support the ones that we find to be most important as a lab. But as, just like someone who's interested in maternal health, you might have different priorities based on, where you live or what your experiences are. And there's so many ways to like find those policies. You can look on your state legislator website. You can look on like the Congress website. So like the ones that are the most important to us are the ones that we've been publishing policy newsletters about. But again, like you might have a different priority for what's the most important to you.
Anyone else want to jump in? We have about a minute and a half. And then I do see one question that we should probably answer. Anybody else? Or are you guys good? Imani, look like you want to say something.
Yeah. So yeah, thank you, Lauren. So definitely we think a lot of the policies we try our best to keep updated by going directly to the mass.gov site and just seeing what's happening right now. We look at what virtual hearings are happening right now. We look at what in which term they were being published in, where are they right now. It's really difficult. Things in government take a while. So it does take a while to truly understand and navigate the system, but you have to start somewhere. And I think we were able to do that just like through learning ourselves and meeting people, and a lot of other community partners in the Boston area have been great. So just like communicating with a lot of people who have some experience in the field. And definitely, if you are interested in maternal health policies, our newsletters are more so to help just introduce the idea, and you can take it from there. And if there is something that really sticks out to you, we try our best to look at a few bills at a time, and we do our best to really push for those. But if there is something that sticks out to you and think that is like very very special, and you think that it has some importance, we are happy to work with you to push for it in whichever city, state you are.
Okay, so we are at time. I'm going to say thank you to my Mother Lab team for providing us with such amazing resources on how everyone can get involved as advocates for Black birthing people. You can join us in the main stage for a video from Senator Elizabeth Warren, and then I'll be back to close out the conference and talk about our networking session. Can't wait. See you soon. Thank you.